Welcome to Revision Hub. Today we're going to be looking at the topic of psychopathology and the unit of obsessive compulsive disorder, OCD, AQA AS psychology. So, what is obsessive compulsive disorder? So, we're just going to break the word down. So, obsessions are recurring thoughts or images, compulsions are repetitive behaviors. And below, I've just listed some examples of OCD that you can briefly have a look at. Characteristics of OCD. The behavioral characteristics are there's compulsive behaviors that are repetitive, for example, tidying, praying, etc., in order to reduce anxiety. For example, you may continuously wash your hands to reduce the fear of germs. You avoid situations that trigger your OCD in order to reduce anxiety. Emotional characteristics include anxiety and distress, depression because having anxiety causes low mood and a lack of enjoyment. Compulsive behavior gives some relief from this anxiety. Guilt and disgust towards something or even yourself. Cognitive characteristics include obsessive thoughts that continuously run in your mind, and this can be an unpleasant feeling. Use cognitive strategies in order to manage these obsessions. For example, praying. But this can be used, but they may make you feel abnormal and you may not be able to cope with daily life tasks. Excessive anxiety results in always being alert and keeping your attention focused on any possible hazards. Explaining OCD. So the biological approach has a genetic explanation, which as it may sound, genes may make you more vulnerable to develop OCD. And Lewis in 1936 found that from his OCD patients, 37% had parents with OCD and 21% had siblings with OCD. So just because OCD runs in families, which means that it could be passed on from one generation to the next, it doesn't really mean that genetic vulnerability for OCD is 100% certain. The diathesis stress model states that certain genes may make an individual more likely to suffer from mental health disorders, but this is not certain because environmental effects do play a role as well. So, candidate genes may make you more vulnerable to OCD because they regulate the development of the serotonin system, and OCD is considered to be polygenic, which means that one gene doesn't cause OCD, but there are in fact a lot of genes involved in causing OCD. Taylor in 2013 analyzed previous studies and found that 230 different genes could be involved in OCD. The genes studied are related to the way that neurotransmitters dopamine and serotonin work, and dopamine and serotonin are involved in the regulation of mood. Different types of OCD may be caused because certain genes may result in OCD in one individual, but a totally different set of genes may cause OCD in another person. And we describe this as etiologically heterogeneous. Evaluation. A strength is that there's good supporting evidence for some people being more vulnerable to OCD as a result of their genes, because Nestat et al. In 2010 reviewed twin studies and found that 67% of identical twins shared OCD in comparison to 31% of non-identical twins. This increases the reliability of OCD having a genetic basis. However, several candidate genes are present, which makes it very difficult to identify all of the genes involved in OCD, making it difficult to predict OCD, and this reduces real-world applications. Another weakness is that environmental risk factors may trigger or increase the risk of the development of OCD. This is because Cromer et al. In 2007 found that half of the OCD patients they had sampled experienced a traumatic event in the past, and OCD was more severe in those who had more than one traumatic event. Hence, genetics don't always play the main role, as environmental effects do so as well, so they have to be explored much more. Another explanation for OCD is the neural explanation. It states that the genes relevant to OCD impact important neurotransmitters and brain structures. Serotonin regulates mood, and low levels of serotonin results in normal transmission of mood-relevant information not taking place, and some other mental processes are also affected. Some of the cases of OCD are linked with reduced functioning of the serotonin system in the brain. When it comes to decision-making system, some of the cases of OCD are linked with hoarding disorder, which is especially linked to impaired decision-making. So in this case, the brain is abnormal in the lateral, which means the sides of the brain, and the frontal lobes, which are responsible for decision-making and logical thinking. And also the left parahippocampal gyrus is basically where you process unpleasant emotions, is abnormal in its functioning in OCD. Evaluation of the neural explanation. So a strength is that supporting evidence for the role of neuromechanisms play in OCD, because certain antidepressants target the serotonin system by increasing the levels of serotonin, and these can play an effective role in limiting OCD symptoms. This increases reliability because it supports that serotonin has a role to play in OCD. However, there is a lack of clarity when it comes to specific neuromechanisms involved, because Cavandini et al. Suggested these neuromechanisms could sometimes play a role but do not always play a role in OCD. Thus, a full understanding of neuromechanisms has not yet been obtained, and so more research in this field is required. Another weakness is that the assumption that neuromechanisms cause OCD shouldn't really be made, because there's evidence to suggest that certain neurotransmitters and brain structures do not function as they're meant to in OCD. Such biological abnormalities could be the result and not the cause of OCD, and such differentiation is not accounted for by the neural explanation of OCD. Treating OCD. So, drug therapy can either increase or decrease the levels of neurotransmitters in the brain, and this can obviously impact activity by increasing activity or decreasing your activity. So you have selective serotonin reuptake inhibitors, so SSRIs, and this antidepressant drug helps to manage the symptoms of OCD because it works on the serotonin system. So usually serotonin is released by certain neurons in the brain, and serotonin is released by the presynaptic neuron across the synaptic cleft. The postsynaptic neuron has receptor sites, and serotonin binds the ones that are complementary to its receptors. Any serotonin excess at this point is probably in the synapse, so it's taken back by the presynaptic neuron where it's broken down and reused, so this entire process can take place again. So what selective serotonin reuptake inhibitors do is that they prevent reabsorption and breakdown of serotonin, which increases their concentration in the synaptic cleft and stimulates the postsynaptic neuron. This makes up for the dysfunctioning of the serotonin system in OCD. So selective serotonin reuptake inhibitors can be paired with other treatments, for example with CBT, in order to help patients engage in their therapy, or basically without or being able to manage the emotional symptoms caused as a result of OCD. Alternatives to selective serotonin reuptake inhibitors are tricyclics, and they have the same impact as SSRIs have on the serotonin system, but for example, a type of tricycled clomipramine has more side effects. There's also SNRIs, which increase the levels of serotonin and the neurotransmitter noradrenaline. A strength is that drug therapy helps in dealing with the symptoms of OCD, because Samora in 2008 analyzed studies comparing selective serotonin reuptake inhibitors to placebos in the treatment of OCD. Better results from selective serotonin reuptake inhibitors were found, increasing reliability. Another strength is that drugs are cost effective because they're cheaper than psychological treatments, which is useful for our healthcare providers like the NHS, because in this way everyone's health needs can become a priority. However, a weakness is that drugs do have side effects. For example, like mentioned, for cyclic chlomidine has major side effects, weight gain and tremors. This may result in the patient not taking their medicines, which obviously limits their effectiveness, and this is not what we really want. Another weakness is that drug treatments are prone to bias, as psychologists Goldacre. This research is sponsored by drug companies, so they may not report all evidence, which is a negative because it really reduces reliability. In our next video, we will be looking at a unit of memory, but before then, make sure you make your notes on what we've covered so far. Remember to rest, test, and repeat yourself. Don't forget to follow us on Instagram. Thank you to Canva because I made these slides using the templates. Don't forget to like, subscribe, press the bell icon, and thanks so much.